Everybody, welcome back to the GEMS podcast. I'm joined today with Steve LeCroy. He's going to tell us about his class that he has coming up at FDIC. So, Steve, I'll pop it over to you.
All right, thank you for the intro. Like you said, I'm Steve LeCroy. I'm going to be coming up to FDIC and doing a presentation. A little bit about me. I'm a paramedic respiratory therapist. I've been an RT since the late 70s, a paramedic since the early 80s. I spent 30 years in the fire service, retired as a captain. I taught paramedic school for about 35 years. And I've also been an expert witness in medical malpractice in about, roughly 130 cases across the US. And I've spoken in conferences in Australia, Hong Kong, Alaska, and various ones across the US. So when I thought about putting in for a presentation, obviously with my background, it seems like respiratory seemed to make the most sense. So it's going to be kind of a combination of differential diagnosis, assessment, and treatment type stuff. Because I also tutor students who are preparing for the National Registry. And one of the areas where they have some of the biggest problems is the respiratory area, which makes up somewhere about 20% of the calls that you're going to have in the EMS. And with my background, I think I can point out some things that not only will help you on the test, but help you in real life being a paramedic. It's really an ahistoric environment that you're going to work in. And we're going to talk about some of the differences between, say, respiratory distress and respiratory failure. If you don't know those differences, you're probably having what I call dysynchrony in your therapy versus what's wrong with the patient. And it's always going to lead to some sort of failure in the care. So come visit me, come see me, and ask me some questions, put me on the spot. I look forward to it. I haven't been, it's been a while since I've been to Indianapolis, so I'm looking forward to that too, even though I'm not a real big fan of cold weather. So hopefully it warms up by then. So looking forward to it. Prepare for it. Come see me and have a good rest of your day.
Hey, thanks, Steve. Appreciate it. And we'll try to order up some nice weather for you by that third week of April. So hopefully we'll have something that's not too terribly chilly. I am really excited for your class. I think your mixture of your EMS experience as well as being a respiratory therapist brings a lot to the table and can really help providers to better understand respiratory physiology and the
Right.
illnesses associated with them. So yeah, I'm
Well,
excited.
I was real lucky early in my respiratory career as the medical director that I had to the respiratory program that I went to. We became friends, and we stayed friends up until he passed away a couple of years ago. And he used to have me go with him on just assessing patients. This guy was probably one of the smartest individuals I've ever been around. And he showed me some things that aren't typically taught and can be really difference makers. And I think that's what I'm going to bring to the table up at the FDIC.
I can't wait to see him. We'll see you in Indy in April. Thanks a lot, Steve.